Harry, thank you very much.
Tim, you're most welcome. Thank you for having me.
Thank you for flying across the pond to join us at the Health Optimisation Summit. I'm absolutely flattered. As we said just before the camera went on, I was very, very happy when you reached out to say, can I come to London? And it's just of course, no-brainer.
It's been an absolute pleasure. You've done such a good job. I mean, the turnout, people are so enthusiastic. I can't believe that the level of enthusiasm among the attendees is just amazing.
Yeah, we're on a par with the numbers that Upgrade Labs had at the Biohacking conference this year, so I'm kind of pinching myself about how it's gone, but it's been a year in the making pretty much, and yeah, it's been fun.
That's
so
great.
Yeah, so thank you for being part of it, because I mean the speakers are really what have made this very, very special. I'm just an idea person, so thank you for coming. So I've got a few questions, a few slightly generic that I put together and a few personal ones for you. But I mean, I'd like to, for the guys that don't know you out there, how do you define what you do?
So I use autologous stem cells for the treatment of pain. The word autologous means donor and recipient are the same person. So as we go through life, we experience injury and we experience degeneration. When you have enough degeneration that there's actual changes in the microscopic tissue, then we get chronic pain. And the best way to approach chronic pain is to use the healing power of nature, to use the body's natural ability to heal itself. Well, the way the body naturally heals itself is through stem cells. So we have stem cells in every tissue in our body, and their job is to regulate the health of its microenvironment. So what we do is we take stem cells from an area where you still have a robust population, such as your bone marrow and fat, concentrate them, isolate them, and inject them directly where the damage has occurred, thereby tricking the body into thinking that it's undergone a new injury without having caused any damage, and launching the body's natural ability to heal itself.
Amazing, amazing. Okay, awesome. So, I mean, it's obvious. My next question, I think this is pretty obvious, but I'm going to say it anyway, is how do you think your niche fits into the health optimization mindset? But I think you succinctly did it with the first one as well. I mean, for me, stem cells is really growing very quickly, not to use a pun. And it's being more and more widely adopted and recognised. And I think people such as Dave Asprey and Ben Greenfield and a lot of these guys that you've been working with, I think Vishen you mentioned as well. If we're allowed to say those on camera, I hope.
Sure. Yeah, it's all public. We filmed the procedure. It's called on podcast.
I mean, I had a sinus lift recently, and Dr. Jose Mendoza, who's a speaker here, did stem cell for my sinus lift, and the bones are growing very quickly. So I've experienced firsthand. And obviously, being here, it's very close to the brain. 2 hours after coming out of general anaesthetic, my brain was the clearest, and I worked until 2 in the morning after I'd been in surgery, and it was just incredible. So I mean, whether it's placebo, I don't know, and I have to say that, but the point is it was significantly different. So I mean, it's amazing how I think you're doing the full body. So if you want to explain.
Yeah, to answer your question, I think there's really 2 ways where it fits into biohacking. One is in the treatment of pain, because in biohacking is largely, I mean, from my perspective, we call it functional medicine or even naturopathic medicine, and that will do a great deal to reduce pain overall. But if you have a dehydrated disc, if you have an arthritic shoulder, if there's an actual area of degeneration in a musculoskeletal structure, there's very little blood flow in those areas. So it's all the sort of metabolic things that we do with functional medicine or naturopathic medicine, it's very difficult to get change to occur in a poorly vascularized area. And that's where putting stem cells using either X-ray guidance or ultrasound guidance can directly impact those structures. So that's from the treatment of pain. From the anti-aging and the longevity perspective, that's where my talk today was about full body stem cell makeover. So, the goal with all of this, with biohacking, is vibrant health, right? Vibrant longevity. It's living long and prospering up until your last breath, right? And so full body stem cell makeover was designed with that population of people in mind, taking stem cells from the bone marrow, from the fat, injecting them into all the musculoskeletal structures, the entire spine and all the major joints. Even if somebody doesn't already have some sort of arthritic process going on, it's to prevent it from in the future.
Fix here, make like there's something here to look at. If there is, it works and improves it. It's really interesting. I think one thing that I'm not sure if it came from you directly or if someone had mentioned it, but you literally go over every joint, everything, each vertebrae, the lot, like literally full body.
That's right.
The full thing.
Sure, I do all the musculoskeletal, the entire spine, all the major joints, and then Amy Killen follows that with the cosmetic work that she does, the skin of the face and the neck, the hair, and then the injections for sexual optimization.
Yeah. I'm looking forward to speaking to Amy actually as well. So yeah, that's awesome. So I mean, the next one I'm going to skip over, but I think the answer again is pretty obvious because for the people watching this, I think they understand this. But I mean, what would you say was the best health optimizing quick win? So if there's one thing that you could pick.
I would have to say, just from my own personal experience, is have your teeth checked because, you know, you've heard my story. I mean, 2.5 years ago, I had a stroke and then I ended up having an open heart surgery, and it was from a bacterial infection of my heart, and it turned out it was from cavitations in my teeth, and that was, you know, I'd had teeth pulled 6 years prior, and had a little bit of problem at that time, but didn't really think much of it. So I would just, you know, oral health, it hit me like a bastard. Yeah. So, you know, I think those routine screenings of a cone scan, I think are a good idea for anybody who's had any teeth pulled or oral screenings.
It's funny because cavitations are controversial, especially in England anyway, and many people say, oh no, there's no such thing, but I mean, I've experienced it myself. I've gone through all these things in the UK system, they said there's nothing there, and then when I got it checked elsewhere, they went, yep, there's a cavitation there, and when they opened me up, it was necrosis bone and full up. It was very, very bad, and that's why I needed a sinus lift. And there's hardly any bone left and whatnot. So I'm on the same page with this, and I think that's why I wanted biological dentists here, and I wanted Jose Mendoza here to talk about some of his work with metals and detoxifying the body and how things like this all come together. So it's really nice for you to hear you say that, because it's been a big part of my journey and of the Health Optimization Summit as well. So what's the best story that you know of or have heard of where what you've done has helped someone? I mean, is there a story that sticks in your mind that goes, yes, this is why I do what I do?
You know, there's a lot of them, and they kind of blend together. And I've had the great pleasure of getting to work with a lot of really terrific people. And the nice thing about treating pain is that the results are so tangible. You know, people say, I couldn't pick up the baby, and now I can pick up the baby. I couldn't walk up and down the stairs, now I can walk up and down the stairs. I've had, you know, a lot of really amazing stories like that, where people, and especially with stem cell medicine specifically for the treatment of the spine, is because, you know, if someone has a bad arthritic knee, worst case scenario, they get a knee replacement. The thing with spine conditions is frequently there's not good conventional options. The only option is fusion, and that's not a good option. I mean, that's just a bad option. So I would have to say treating dehydrated discs and probably post-whiplash syndrome, but conditions of the spine where these people really, there are no conventional or alternative options, and this is really the one treatment that I've found that really can take their pain away.
Amazing, yeah. I mean, I heard a lot of people speak about back pain with you, and I think this is it's one of the key areas that people come to you for. But obviously, the full body stem cell makeover. I know from my side, and I get to speak to a lot of the influencers and things, and they're saying this stuff is absolutely amazing. And so, I mean, I know that they're kind of the two main areas that I know of your work. So it's great. So thank you for that. One thing that comes up all the time is, where do the stem cells come from? Does it hurt? I mean, even someone just before this, one of the speakers said, you know, was a bit concerned about how you get the stem cells. Is there a less invasive way, or is it bad? Is it painful? Because I think this is, again, a roadblock to some people getting it because they're worried about the procedure to get them. So, I mean, I would love to hear your the words from the man himself, I guess.
We sedate everybody because it is get stem cells from bone marrow to get stem cells from fat is quite painful. And what I found, for a number of years, I would give people the option of being sedated. And what I found a couple of years ago was I sort of just insisted that everyone gets sedated. And it's not mandatory, but it's included in the price, so you may as well do it. And what I found is overwhelmingly I get better outcomes because people have a pleasant experience. They go to sleep, and they wake up and we're done, and they don't really have any pain at all. So the experience is really very simple and gentle.
Awesome. Yeah, I mean, I think being awake for something as well is you're going through a trauma, whereas if you're asleep, you're not. And so therefore, it's the hormonal side of things, I think it's significantly better. So for healing or the pain in the first place. So I think that's great. Okay, awesome. So, I mean, how have you found the summit? So tell me.
It's been fantastic. It's been, you know, I'm fortunate enough to have been a speaker at Upgrade Labs, and before that, Bulletproof 2 years in a row. And this, I would say, is absolutely on par with those meetings, except it's in London, which is fantastic.
Thank you for saying so. I'm very happy with the size and how it's gone. I mean, there's always a few roadblocks, but as a true biohacker, I've gone, what's the data? What do I do to optimize it to make it better for next year? And in fact, it's been so crazy that we've already penciled in with the venue for next year, and most of the exhibitors have been saying, like, I want the same space I want next year. So it shows that we're doing something great, which I'm very, very happy for my team to have helped me with.
Terrific.
And done it for me, pretty much. So thank you very much for your time, Harry. I really appreciate it.
You're most welcome, Tim.
Thank you.